As it is 1 o'clock, and we're Dutch, we'd rather be precise, and we have a full schedule as well. I would like to welcome you to this session on transparency along the pharmaceutical value chain, informed price negotiations for access and affordability of medicines. My name is Guy Muller, and together with Professor Wim van Harte and more than 10 cancer societies, we founded the European Fair Pricing Network more than 5 years ago. We, more than 10 cancer leagues across Europe, find it inexcusable that we finance cancer research, stand side by side with European patients, and witness that equitable access to affordable, high-quality medicines is lacking in Europe. One of the main reasons? Unreasonable high prices. That is why we came together to found the European Fair Pricing Network. The network is a unique enterprise that combines research and advocacy to ensure change in a pharmaceutical system that hinders access to affordable medicines. Better medicines, fair prices, more transparency, and access for all patients in need in a timely manner. Today's session will zoom in on the lack of transparency, the way it affects unaffordable high prices, and the consequences it has for payers and patients. To be clear, the European Fair Pricing Networks aims for fair prices, fair for all parties, patients, payers, and industry. A fair price is for once a price that can be explained to all. Transparency, therefore, is essential. That is why we will be hearing today from NGOs, research, HTA buyers, and journalistic and political perspective. Before I give the floor, this is me, hi. Very short housekeeping. So we want to invite the audience to actively participate during the panel discussions, and we invite you to join us at the informal networking event outside of the plenary room straight after the session. So without further ado, let me welcome Jaime Manzano, Research and Advocacy Manager from Salud por Dejo.
Thank you very much. Thank you, everyone. Thank you, KWF, for inviting Salud por Derecho, a Madrid-based foundation, to explain our transparency activities. So there are no slides, so just you have to enjoy my voice for the next 10 minutes. I will build a little bit on the topic of transparency, and we go right away into what are we doing for increasing transparency in the markets in Spain. So as it was already mentioned in the introduction, ensuring equitable access to affordable medicine from our vision is a fundamental human right that is becoming increasingly difficult to fulfill. And we are seeing how the sustainability of health systems around the world has been impacted by the dramatic increase in prices in the last years. We are seeing gene therapies priced at $3.5 million in the US, and we have seen how the median annual oncology cost for new medicines launching to the market has more than tripled in the last decade. So there is a growing perception that companies are charging unfair prices, but how do we establish what fair is? And that is the question that I'm going to repeat throughout my presentation. So, as just mentioned, transparency is a key element to establish what fair is. But here comes the thing. There is a lack of transparency throughout the entire pharmaceutical ecosystem. There is a lack of reliable data, from clinical trial data to R&D costs to medicines' real prices, which is what we are here for today. This situation exists despite there is a World Health Assembly resolution from 2019 that encouraged governments to take appropriate measures to make net prices of drugs available. And by net prices, we mean the amount that manufacturers get after subtraction of all rebates, discounts, and other incentives. Okay, so how did they get to this conclusion back in 2019? Or in other words, how does lack of transparency impact high prices? this is going to be just 30 seconds of how a global system works, so I won't go into the details. This is then for the questions, but decision makers around the world often rely on official list published prices, what I'm going to call list prices, as benchmark to determine the price they will pay. So this system creates incentives for companies to offer confidential discounts with the objective to keep the reference prices as high as possible. By keeping the real price, the net price I just mentioned, secret, we prevent everyone from demanding the lowest reference price available. Okay, so how, it seems a bit not so fair, this system, but how is justified? So companies justify this as the appropriate means to ensure affordable access to medicines, and the pharmaceutical industrial lobby claims to support a system where richer countries pay more and poorer countries pay less. So purchasers of drugs are being told you have made the best deal possible, you get the best conditions, you get the best price, in exchange for not disclosing them, often protected by non-disclosure agreements. Okay, so you have made the best deal possible, but you don't have the means to evaluate whether that's true or not, because it's confidential data. What is clear is that everyone cannot get the best deal possible, so someone is getting a bad deal. Who is getting that a bad deal? Okay, we know one thing for sure. Prices change depending on who is buying. But contradicting pharma's argument, more often than not, richer countries get better prices than poorer nations. And that will be explained later on in the presentation, but just for making the point here. So what the system is created is an information asymmetry system where companies maintain leverage and other stakeholders remain in a sort of a prisoner dilemma. No one is doing what the rest are paying. No one knows anything else. Okay, Spain is within this net of opacity. And net prices are not transparent. So since 2019, our coalition, No es Sano, is not healthy, has been working on this issue, and we have been requesting the Ministry of Health to disclose net prices. How the system works is that you can request through the Transparency Law and the Transparency Council an official document that contains public information, and if the administration doesn't allow you access to this document, then the process can end up at court. We have done that since 2019 with the CAR-T Kymriah, where we requested data, and that process was stopped due to a formal defect, but we got a transparency resolution that said, you were right asking for this information, so asking for the objective criteria of how drugs are financed is of public interest and is intrinsic to democracy. So that's a huge milestone. Okay, we forward, and we are now in 2022, and we ask again the Ministry of Health for 3 net prices and public health budget impact of remdesivir, Veklury, Zolgensma, and Takhzyro. And we got a very similar answer as any other groups that has requested net price transparency, and is that the Ministry of Health said that that's confidential information based on we don't know what grounds, because our law says very specifically that confidential is what you get from the pharmaceutical company during the negotiations regarding economic, technical, or financial aspects, but not the outcome of the negotiation, because that it's a public document, and according to the transparency law, every public procurement contract should be public with object, duration, and amount. So here we see how transparency law as an effective mechanism to request transparency on net prices. The Ministry of Health appealed to court, and we are now awaiting final sentence for all these cases, and probably we can discuss this a bit further during the Q&A session. So how is this action important for patients? How demanding for net prices is important for prices? For us, opacity only leads to blindfolded negotiations. Blindfolded negotiations only leads to worse outcome for payers. So that means higher prices at the end. What does it mean to have higher prices? Well, higher prices is, like, to put it simple from a patient perspective, is that patients won't access the drug when they need them, or if there is an availability of this drug, it will impact in such a way the health system sustainability that we will see that by overpaying for some medicines, there will be an impact to other health outcomes that are achievable by the use of the same resources. So at the end, we are impacting other patients in other therapy areas, other health gains, and our shared public health. Okay, so for wrapping up, I think I'm okay, for closing the session, what do we want to aim here? So we want this to be of public interest for 4 reasons. 1, transparency is needed for fair negotiations. Fair negotiations are needed for fair prices. We are fighting against information asymmetry. 2nd, transparency is needed for good governance and accountability. How do we hold our powers accountable if we don't know what they are paying? How do we hold corporations accountable if we don't know the objective criteria that they use to set their prices? So this is needed for democracy. Transparency for global health, because these prices are used as reference prices elsewhere, and patients around the globe are impacted for high prices in Spain too. And finally, because we want transparency throughout the entire pharmaceutical value chain, because you cannot talk about fair prices if you don't talk about what was the public involvement, what was the R&D costs. What we will see in the future, we have now mixed views. We have 2 rulings by the High National Court against net price transparency. We have 4 rulings by first instance courts in favor of price transparency, and soon we expect to see a Supreme Court ruling that establishes jurisprudence on what is happening in Spain with price transparency. Is that of public interest, or as the companies and our Ministry of Health that is already is appealing also together with the company the resolution, it's confidential. For us, that's a bit strange, and I want to end with a quote that a member of our coalition did to investigate Europe, that in Spain, the only 2 areas where destination of public money is not known are secret service funds and medicines. And this cannot be a nice future for democracy, for patients, for global health. Thank you.
Thank you very much, Jamie, for this excellent presentation and also giving the perspective from an NGO and a patient perspective why this is so important. Then without further ado, let me present Professor Wim van Harter from the Netherlands Cancer Institute and Senior Research Group Leader at the NKI, and Professor of University of I want to say FC Twente, which is the football club, but of Twente. Wim, the floor is yours.
Thank you, and thank you for being here. I will start right away with explaining the activities of the European Fair Pricing Network. We have done a number of research projects related to the access and costs of drugs on a European level, supported by 11 cancer charities. And we started to map the actual access to 6 expensive cancer drugs in the European setting. This is rather intensive work because we did not relate it to the coverage decision of a country, but we related it to the actual first prescription of a drug in a hospital, documented in the medical record and verified by the pharmacist. So these are rather detailed activities. And what we found, and these are the data of 2 of those drugs, is that we, if you see the date of EMA approval, so access to the European market, and you look at the various hospitals in a country, you see usually differences in the first prescription to a patient, often in a more specialized hospital, but not always. And these differences can mount up to 8 years from the first to the last, at least, patient registered in our research. And what we see is that access to new expensive drugs and effective drugs sometimes, because that's also a different discussion, within a country can differ in amount of years, and also between countries you see differences. And the reasons for these differences are differences in regulation. Every country has its own HTA decision system, differences in early access programs, which are not always so transparent per country, but also differences in pricing and the budget impact that is sometimes a real issue for patients. So this underlines the reasons with data that looking into pricing and costs of drugs is a very relevant issue for access of patients. And here are the different steps that we took in this research and analyzed it per phase. And if you look at price negotiations, the issue is that prices, you have to make prices comparable because you have in some countries you have VAT, in some countries it's the pharmacy, sometimes there is a rebate, a formal rebate, sometimes there are distribution costs, but always, or almost always, there is an agreement between an agency and pharmaceutical company, and usually these are confidential, and what the result of those negotiations is very difficult to trace. The former speaker already said something about it. And we took the effort to analyze these data on two levels in this project. One on national level, because most countries have a system in which they negotiate very expensive new drugs in terms of a managed entry agreement or managed access agreement. And some countries disclose their savings or rebates, and we analyzed the actual costs of drugs on hospital level, which is a very difficult issue because of those confidentiality agreements. You have to have a legal way of anonymization that safeguards the agents from liability or the option to be sued, and still present data on various countries. But I will first show something on the country level. And what is apart from these pricing issues, and you also have dosage differences, so making the data comparable is a very delicate issue. You see that almost every country organizes its pricing and reimbursement decision system in a different way. I have highlighted the Dutch system, but we have this for 13 countries, and we did not find one country comparable to the other, and that is just on European level. And finding out the reported rebates and results is quite an issue. This is the slide on all these different price aspects. So when you do a comparison, you have to be very careful in actually checking what you are comparing. I will not go into the details of the technicalities, but we have to be very sure that either on national level or on hospital level, you really compare apples with apples and do not have confounding, which is very easy in this field. So this research has to be done very minutiously with experts from the countries and the hospitals, and I will show you a few slides because the results are being finalized now and verified by our legal advisors and by the co-authors, and will be submitted in the coming months. But if you look, for instance, in the number of managed entry agreements per country, you see in a number of countries that we present here, not all 13, that the number of those agreements is growing, and that some countries are more secretive about their rebates than others. And for instance, the Netherlands is quite open in its resulting discounts. This is official public information, and it's called the sluice, in which they negotiate those amounts, and they report a rebate of 46% per year, which saves the country over 744 million per year. That is to say, if you take the list price as the reference. And of course, in this system, it is very interesting for the pharma companies to have as high list prices as possible, because then you can give a large rebate to the countries, and as a negotiation strategy, almost every country is satisfied with these results because they will receive high rebates related to these list prices. But what you have to compare are the actual amounts and the comparable prices over Europe. We have those data, they will be published, but you see here, for instance, a difference between the data from the Netherlands and France, in which France has higher amounts as a result of the negotiations because of the size of the country, but in percentage is almost half towards the Netherlands. So to make these data comparable is really an issue, and we are still working on that point to present it in a proper way. But also hospitals negotiate for discounts, and I will show you some of the conclusions of the total study in a moment. This is still confidential, so even if you make photographs, please be a bit restricted in the use. But anyway, this is only 12 of the hospitals that we interviewed from 5 countries, and we saw an average discount on hospital level being achieved in their negotiations of 28%, related to either patented or non-patented drugs. So if you have generic drugs, you have obviously a very high possibility of market influence and a high rebate. And you see also a difference between monopoly, oligopoly, or free competition drugs in terms of rebates achieved. And we have done this for groups of drugs, so you can also expect in our publication rebates on averages to be achieved by hospitals or hospital groups and grouped by these drugs. But also when you go to public prices, and this is what we use as reference data from IQVIA, which is a company that is fed by pharmaceutical companies on the actual sales of drugs, and you can use those data, and then we see that the public prices that pharmaceutical companies report to us on certain countries do not have a very strict logic. You cannot say that, and that was the first, it is a new drug for breast cancer, that, for instance, the most rich countries have the highest prices, although in enzalutamide for prostate cancer, it seems to be a bit more narrow, but be aware that the prices that are charged, and that is not negotiated yet, still differ a factor sometimes of 2. And so you have, and it is not necessarily the richest country that has to pay the most in these data, and this is a lot of countries that we have data on. But if we go to the summary of the study that is to be submitted soon, we have data from our fair pricing network on 23 hospitals, which are applauded for their commitment to take part from 9 European countries. And we see in the national level that discounts, reported discounts, range from 7 to 38%. But if you look at actual medicine prices, and we have 15 drugs included, over all these countries, they can differ in absolute terms from 27 to 183% in actual price. And overall, this brings us to the conclusion that we have unequal access in a completely intransparent market, with pharma obviously in the lead when it comes to regulating the system. So there is an urgent need to improve bargaining power in drug purchasing on all these levels that I presented. Thank you very much.
Thank you very much. And without further ado, I'd like to ask Dr. Iga Lipska to join the stage. Iga is the chair of the board of the Health Policy Institute in Poland, among many other things. Thank you very much. Welcome, Iga.
Hello, everyone. I will stay here. My name is Iga Lipska. I do come from Poland. I'm a chairwoman of the board at Health Policy Institute, which is an NGO. But I used to work at HTA agency, governmental agency actually in Poland, and I was also responsible later on for negotiating prices on behalf of Minister of Health in Poland with pharmaceutical industry. So I will give you a kind of this Polish, but also Central Eastern European perspective on drug pricing negotiations. But I will start like 20 years ago, perhaps some of you don't remember this, but at that point, 2004, Poland accessed European Union, so we had some obligations with regards to Transparency Directive, also with regards to prices of pharmaceuticals, but more importantly about decision-making processes on pharmaceuticals. So what we did in 2004, actually there were a kind of very serious legal issue with European Commission, so Poland could be taken to the court because we didn't implement Transparency Directive. So we used this opportunity, or we take this as the opportunity to implement fully more transparent pricing and reimbursement system for pharmaceuticals in Poland. So what we did, we established HTA agency, and it was my actually pleasure and honor to work there. So we established evidence-based decision-making process for pharmaceutical pricing and also negotiations. So it was 2005, but later on, and actually we received 2 million euros, as I remember, to support the creation of new pricing and reimbursement system in Poland to make it more transparent, to make the basis for true negotiations with pharmaceutical industry. And a lot of EU experts supported us with this. So it was supposed to be like more transparent pricing system in Poland for pharmaceuticals. What we noticed, but a lot of international experts came to Poland, we exchanged experience, etc. So we built the system in which one part of the process was health technology assessment, and it was based at HTA agency in Poland. So it was like clinical effectiveness, cost effectiveness, budget impact, other aspects of new innovative medicines, for example. And then the results of these HTA processes, they were transferred to Minister of Health to give a background for pricing negotiations. And that at Minister of Health, but it was in 2012 only, so we had this economic commission, which is responsible and still is, and I had also the opportunity to negotiate pharmaceutical prices. So we had this, let's say, evidence and scientific background to negotiate process, but what we used was, and most countries do this actually, we use international reference pricing system. So we try to look around, to look at several countries which we choose, and we compare prices. So this is the starting point for pricing negotiations. But on the other side, you need to negotiate with really strong global companies. So probably like negotiation capacity in Poland is not so huge. We've got huge population actually. It's almost 40 million people. So even for rare disease, etc., the population is really big as compared with other EU countries even. And then we've got huge budget impact consequences. What we noticed, and actually I find this quite interesting. So, of course, patients in Poland have got delayed access or almost no access to innovative medicines, including oncology medicines. But there are several reasons for this. I think because we use this international reference pricing system, we only look at net prices in other countries. And as far as I'm aware, and I do work a lot at international level, I think we've got this illusion, let's say, that we do really negotiate good prices. However, we don't know if our deal is really the best one, because we can't really compare, we can only guess. So that's really not transparent at all. However, if you start your negotiation process from really high prices, you can feel at least quite successful. What is also interesting about Polish healthcare system, that the access to innovative medicines is delayed for Polish patients. And if you look at the timelines, and actually the timelines were also presented here, you've got one point in time, which is EMA, so European Medicines Agency approval, marketing authorization approval, binding for all EU countries, but then you've got these industry submissions to particular countries, and pharmaceutical systems are so country-specific, so it is even difficult to compare, as Professor Wim said previously. But when you divide or break down the timelines, you can see that really the industry, so especially global pharmaceutical companies, they submit later on to countries like Poland or other Central Eastern European countries. What we hope, and I'm an HTA expert, we've got this EU HTA, so Health Technology Assessment Regulation in European Union, which is coming into force. It was signed by EU Parliament January 2022, but it is coming into force the 12th of January 2025. So we will have this joint clinical assessment, and perhaps for all innovative drugs, so we are starting from oncology and ATMPs. So perhaps this would be also a good starting point to think a little bit beyond clinical effectiveness. And I know I've heard from others that some countries have already signaled that they are interested in going a little bit beyond, so perhaps also into cost effectiveness. I can notice that some of you are nodding, so cost effectiveness and perhaps also price negotiations. I know it is a long way, but perhaps it will be really fair for our patients to make more drugs and more affordable drugs for patients. Thank you.
Thank you very much. Now I'll give the floor to Doreen Manson. She's the CEO of the Dutch Cancer Society, my boss as well, to lead the panel discussion. The floor is yours.
Thank you, Guy, and thank you to the speakers for your very rich presentations from different angles on the topic of transparency, what we are here talking about this afternoon. So I would like to introduce the speakers again back on the stage for the panel discussions and open the discussion for questions for you all in this room as well for later on. So Jaime Manzano from Spain, the Research and Advocacy Manager, please sit down, and Wim van Harten. Different roles we saw, but also you are the advisor for the Scientific Advisory Board of EFPN, so in that role. And last but not least, Iga, please come forward, the chair of the Board of Health Policy Institute in Poland. And then we have a different angle not talked about yet. I would like to introduce Eurydice Bersi to the stage. She's an investigative journalist from Investigate Europe and Reporters United. And she did important research on the same topic, what we are talking about this afternoon, and published her research and article in last year in June, and it was called Deadly Prices. So let me give the phone to you, the mic to you first, to introduce yourself a bit further, and maybe explain what your study was about and what it showed from what we've heard before. Oh, you have a mic next to you. So Eurydice, please.
Does it? Does it
Yes,
work?
it works,
Okay.
it works.
Okay, thanks. Thanks very much. I know it's weird to have a journalist in this setting, but what we did wasn't just writing an article. It was a long investigation. It involved several countries. And it took us to discuss with experts, with officials, with academics, and the outcome was around 50 articles in 20 media and TV and press in 16 countries. We tried to investigate without having in mind industry or state or whatever interests. At Investigate Europe, that's what distinguishes us. So we tried to look at pricing in the way that hasn't been looked at very much. And what we found was it rhymes with what we have heard from the scientists here, and that is that what is being said, that, for example, that pricing is beneficial, pricing secrecy is beneficial to smaller countries, is not the case. Let me let me describe what we did, how we tried to find the secret prices, because we said it's not possible that you cannot know what the price is. There must be a crack in the wall, and the crack was a therapeutic category. It's not cancer. Cancer is huge. You cannot find prices, real prices for cancer. But there was a therapeutic category, cystic fibrosis drugs, where one company dominates. So you can look at company accounts, compare them to publicly known information, divide by publicly known patient numbers, and get an idea of what is the real price across Europe. And this idea was, to put it simply, a price-volume arrangement. It's not, if you're a big country, if you have lots of patients, you get early access and better prices. To give you a range in prices, it was 70,000 in France, 175,000 in Lithuania. That's the difference that we found. There's our estimates. For all four drugs in the cystic fibrosis category, but still, this is very powerful. And we wanted to tell the audience, to tell the people that were reading and listening to our reports that this is not fair. And we actually we were shocked to hear how people were blackmailed, that's the word. And they were telling us, and we have it on the record in some of our articles, small countries literally blackmailed that they were not going to get the drug if they do not agree to higher prices. So, yes. Do you want me to stop somewhere here?
Yeah,
Because
maybe
I can go on
that's
forever.
quite...
I mean, it was
No, I think it's good for now. We
Okay.
probably will come back to that. So thanks for that overview of your important research. And maybe another question, and then we will open the floor, obviously, for the discussion from the whole room here. But earlier on, we were talking about the arguments you often hear from pharma why it's not possible to be transparent. Is that if it were so, the low-income countries would suffer from that? Maybe Wim, you could say something about that. Is it true, or is it a myth, or what do we need to know about that argument?
What I can say, in an earlier research project that was published in Cancer Discovery, we did an economic experiment with 4 countries negotiating with a pharmaceutical company, in which there was a proper introduction of the participants and also a bonus for their performance, as this is done in those economic experiments. And we negotiated on a cancer drug with pharma on country level with the usual system, with no transparency, with transparent prices, and with transparency on prices and underlying research and development costs. And that is because of this argument. And what we found is actually that the full transparency performs the best for both reaching lower prices for low-income countries, as well as keeping research and development on level. From a research point of view and an economic theory point of view, it is not necessarily the case, or there is some proof that research and development can be obtained in combination with transparency. So we pleaded for natural experiments of countries daring to start using transparency in these negotiations, because there is reason to believe that it is not so somber as the pharmaceutical companies presented.
Thank you very much. Obviously, there will be questions from, yes, Rui. Maybe you wait for the mic to come to you. And maybe introduce yourself.
Yeah, sure. I will do that. My name is Rui Medeiros. I work at Porto. I work at Cancer Leagues and at Cancer Hospital, and also I was the former president of ECL. So I would like to congratulate you for this very important discussion. My question at the moment is for Professor Van Harten, which I find your results very interesting. I'm sorry there are no results on Portugal. I was very keen to see the discrepancy because it's all public out there.
We tried and we tried and we tried.
I can help you on this. I'll send you a mail. And after, the question is, you have shown us a very interesting slide on the difference on the public prices. Do not follow a fair logic. And you show between ENSA and the other one, it's interesting because it's clear, no logic on that. And I would like to ask you, because the price of the drugs has a trend if it's a new drug or an old drug. ENSA has many years. So I would like to ask you, do you think that those differences will be minor if we have a drug with 10 years of use or more? So the discrepancy on the prices will be lower during the time of use within all countries. So it's a question for you.
We do not see that in our data.
No?
No. Okay. We even with off-patent drugs, we see huge differences.
Even for all drugs?
I don't know, but
yeah.
In our set we found that also for off-patent drugs you still see huge differences.
Mm-hmm.
But of course the amounts are much less.
Of course.
So the impact is less, but the differences remain.
Okay.
Thank you.
Thank you very much. Other questions to the speakers you've heard so far? Yes, Mark.
Yes, thank you, Doreen and colleagues, and thank you for the nice presentation. I have a question for Professor Van Harten. By the way, you have a nice family name. Van Harten in Dutch means right from the heart. I think, yeah, it's beautiful. I think it's good we approach this subject right from the heart also. Right from my heart is how does the pharma industry react to your results? Because they are quite clear in terms of differences in prices and discounts, etc. Did we already confront them with, how do you explain this, dear people from the pharma?
Well, there was a publication some 10 years ago on actual prices, and we noted that pharma was either silent, keeping silent, because steering up the discussion is not very useful for them, and even explored legal options against the research group. But that's why we also have extensive legal advice also for the participating institutions in these studies now. But I think they neglect it as much as possible, because the data are rather confronting, and the present system suits them well.
Thank you. I think Luc has a question here.
Thank you, Luke Thomas from CEO of World Child Cancer. So historically, when prices get squeezed in one area, the balloon just expands in a different place, and globally, about 50% of profits from the pharmaceutical industry are in one country, they're in the US. And Europe is, in comparison, quite a small market. So I'm just wondering if you think, and this is for the whole panel, I don't know who thinks they can provide the best answers, but is it realistic for Europe to address this in isolation when actually there's, that balloon will just pop out somewhere else, and it could then potentially have impacts on low to middle income countries where there's already very fragmented access to treatments?
Thank you, Luc. Who's gonna take, maybe Jaime?
Okay. Yeah, that's a very good question about this price convergence theory. I will take it from the other angle. We are already seeing bad results in low and middle income countries. So AstraZeneca vaccine during COVID was priced double in South Africa than in Europe. We saw that pneumococcal conjugate vaccine was priced higher in Tunisia and Morocco than in France. So it's not that we have a perfect system and we might break the system, it's that the system that we have already is not working. And it's also, it's a greater discussion, and of course the US bears some burden of the global R&D cost, but that's something that we are also, we discussed before at lunch with the Pharmaceutical Accountability Foundation that is represented here, that this is the same thing with CSO, with civil society. This cannot work without international cooperation. We know that at all levels, from pool procurement, including transparency, we need coordination for that matter. Because, for instance, Spain as a country can condition their R&D funding on the condition that net prices are transparent, only for us. Would that make sense in a globalized pharmaceutical market? Maybe they just go to another country and they do all these strategies that Investigate Europe has seen, and they will get the same amount of money, just charging more Polonia, Lithuania, or other countries. So at the end, like this is something we have proposed at the European level. Like we have much more power as a European Union. For instance, when we are talking about giving incentives in the form of regulatory data protection, market protection, supplementary protection certificates, patent protection, condition that incentive to net price transparency, because at the European level you can do that, you have the purchasing power. So yes, of course, that's one problem, but cooperation is the thing. And also in the States, there are very good initiatives about transparency acts that I wish we had similar proposals in the European Parliament about how to disclose clinical trial results and so on.
So in that regard, the discussion in the US is just starting. But from, and I think we should not be, let's say, pharma bashing, because they do very important work. Only the societal responsibility they show that can improve, in my view. And if you look at the numbers of cancer patients throughout the world and the expected numbers, there's enough to earn in the coming years. So that should not be the problem.
Thank you. Iga?
If I may only comment on that, I think there are several aspects of this, but perhaps there are some minor steps which could be taken. For example, the publication of joint clinical assessments, as I said before. I've been really surprised how many other countries, really outside Europe, want to take a look at this, because it's all clinical evidence gathered together, assessed, put together, and published. So that's really a lot. So perhaps there are some minor steps which could be taken. It's not only about joint collaboration, global scale, etc. I would say there are some steps to be taken.
Thank you. I think there's room for one more question. Yes. Wilbert.
Yeah, sorry, Wilbert Bannenberg for the Pharmaceutical Accountability Foundation. If we can't actually already find out what a fair price is in Europe, how is that now in Africa and lower middle income countries? I mean, at the moment, the situation is worse for cancer than it was for HIV. I worked under Mandela's government. Then 1.3% of the AIDS medicines was in South Africa or in Africa. Now, of the new monoclonal antibodies, less than 1% is in Africa. So things have changed. We lost a lot of time in the HIV epidemic. In the end, the companies did agree to have the generic companies to supply, and prices went down to licensing. Why don't we actually do something now really for the lower middle income countries? Patients, cancer patients, wherever they are, have a human right to life, health, and access to the medicine. And if the companies are not able to have the price that they want, maybe they can do an access program or give a license to the medicines patent pool. This has been done before, and it worked well for HIV/AIDS. So let's not actually let all these cancer patients down. They have a right to have that drug that we are now already having in Europe. Thank you.
Thanks, Wilbert, for your plea. Okay, I think if there's no more questions for now, I'll give the floor to you, Jon. Oh, one last question over there. We have space for that. Or another statement. Okay.
I don't know. I'm just curious. How many people from pharma industry are in today here?
Can I see hands from who from the pharma is here?
How many people representing Ministry of Health or government are here today?
The government.
Okay, I represent the pharma industry. I want to thank you for all the work you are doing. I have been following this conversation since I think 10 years. I may not agree with all the statement, but that's not the point today. The point for me is that I think we have a common interest, which is we want to get very fast to patient. I think we have different position, but I really think we need to stop to talk in silos. So I really think, and I would like maybe you to do this, we need to convene a proper dialogue. We have been putting forward different solutions. Somebody said we are happy with the situation we are in. I don't think so. I don't think we ever liked the international reference pricing. We came forward with other provisions like the equity-based tier pricing. Let's discuss. But we need to have the right people, so I cannot keep talking to my fellow.
No. Good that you are here.
But I'm here. I'm happy I was here, and thank you for the session.
Okay, maybe Eurydice.
Very quickly, all the solutions from what we've seen that are proposed by industry. First of all, thank you very much for being here and for this intervention. All the proposals we've seen still keep price secrecy in the core. So even the tier pricing system, secrecy is still there. Or am I wrong? It would be nice to yes.
We can't solve it here, but thanks for...
For example, all the efforts at joint negotiations in Europe have been mostly opposed by industry, but those that have gone forward still had price secrecy in their core. So we are looking at something that is very much in the heart of industry strategy, and it will be fantastic to find ways forward that suit both industry and civil society that overcome this.
Thank you. Good last words for this panel discussion. Thank you all for your contribution and you for your good questions. And I'll give back to Guy. Thank you.
Thank you very much. As we're had a great panel, I'm not going to summarize it. I'll give the floor to John in a sec, but there was one thing that I really liked and wanted to underscore. Well, first of all, thank you very much for all the questions and statements, and thank you for being here, because we are really open for a dialogue and a step forward. That's why we start this initiative. And also the European, or we can't do this alone on one level. We have to do this on a broader level, on the European level, and I think that's why the network also proves its value. But without further ado, to one of the most exciting points of today, I would want to give the floor to John.
Thank you. Thank you for being here. My name is John Kirkenes, and I'm here on behalf of Ingrid Stenstad Valros, who is chair of the EFPN, and she also is chair of the Nordic Cancer Union and the Norwegian Cancer Society. And I think the key for EFPN is that we have combined research and advocacy. So, and I have also noted the wish for low and middle income countries and the wish for dialogue from the pharmaceutical perspective. We are going to step up. Where are we heading? We are going to take EFPN 2.0. And that's all about making a transparency and equity index in the pharmaceutical market. As you can see, we want to map transparency instrument and initiative along the pharmaceutical value chain and development of a transparency and equity index, as we told. And use also, because in this morning we had this plenary session about AI, and we will also look into what AI could give of opportunities. And we also want to have look into real life experience for affordable prices, how we could make new strategies for bargaining power in joint pricing negotiations, and how we could experiment to test bargaining strategies in purchasing alliances. And also the last point there, building transparency on public and R&D costs, and see which model is supposed to be the best ones. And as I said, it's research and it's also advocacy. And just 4 points that we are thinking about: extensions of joint procurement procedures, for instance in rare and pediatric cancer and the novel cancer. And we have the new transparency directive that we wanted to work with. And also, of course, as you all know, the revision of the legislation of supplementary protection certificates. Yeah. And of course, the last one, who is a big one, the European pharmaceutical legislation about shortages of protection period and so on, and how we are going to see like an open market, and also like EU could be a good marketplace for the pharmaceutical, as you said, started with the fair pricing and so on. So we want to step up to have this EFPN step 2. So take a picture of this one, find out more, and please join us if you have questions or want to be a member and so on. So with that, I say thank you, and passing the word to you, Guy.
So yeah, now it's up to a drink and have a more in-depth conversation. And please feel free to scan the QR code if you want to find out more about the network. And also, well, everybody will be here, all the experts and all the panelists, and also some of the founding members of the European Fair Pricing are here. So please ask them and please join us. Thank you very much.